Do you want to know the real root cause of chronic low back pain and sciatica? Well, chronic pain is like this cup. It's only so big. It can only hold so much stuff. So if I take this cup of water here and I overfill this cup, eventually we're going to get a mess here. Water all over the place, right? Something has to give. You, physically, emotionally, mentally, like this cup, can only fill with so much stuff. You can only handle so much stuff on a given day. And when it overflows, you get injured or sick or a disease or something. Something has to give because you can only take so much all at once. So you go to your chiropractor or your massage therapist or physical therapist, and they tell you that your pain is due to something physical. You've injured yourself. Maybe they say it's a disc herniation, or perhaps they say it's muscle imbalances, whatever that means, or muscle knots, whatever that means, or some type of muscle strain. Okay, something physical represented by the red dye. Eventually, you're not getting better. So you try alternatives. You try somebody that tells you that your pain is due to stress, maybe stress or poor sleep or poor nutrition, and that those things are the cause of your stress or your pain. And so what you're missing here is that the chiropractor with the red dye is going to try to take the red dye out of this cup. Already, that's impossible. The mental health therapist, the nutritionist, the person who tells you that the pain is all in the brain, they're trying to take the blue dye out of the cup. Now that this is mixed inside the human body with your experiences, beliefs, your physiology, your emotions, and your experiences, this stuff mixes up. And when it mixes up, now we're not dealing with a red or blue dye situation. We're dealing with a purple dye situation. Neither red, not just physical, or not just blue, not just mental, not just stress, not just emotions. It's purple. And so in order to fix the pain, you need a purple dye solution, which means addressing this holistically. Again, not just one or the other, but both and more. Here's green, let's call that nutrition. Here's yellow, let's call that environment or beliefs or people or places or things or your job, who knows? But we have to take a look at the entire rainbow, the entire spectrum of influences on your life and see which of these has the biggest influence. Now that it's combined inside the cup, how do we get it out? Oh, and by the way, just like this cup fills up a little bit each day and shit piles up, you can only drain the cup so much every day. So every day you get to sleep and you get to drain a little bit of the water and empty your cup. Oh, and you get to eat healthy food and rest and recharge. But I can only recharge so much on a given day, just like this tiny cup here. I can only drain so much from my metaphorical cup each day. I can only recover so much each day. So if I'm not taking adequate time to recover, to get good sleep, eat good, healthy, anti-inflammatory food, feed myself healthy things, if I don't recover well, then my cup just keeps filling up and up and up, and then eventually it overflows. So how do you fix the pain? Well, one, you take stuff out of the cup on a regular basis. That looks like rest and recovery, but also looking at the situations in your life that is just filling up your cup constantly. And number two is build a bigger cup so you can hold more stuff and it doesn't even matter. And what that means is becoming physically strong and resilient and having better mental health coping mechanisms as well. So take stuff out of the cup, build a bigger cup. That's a holistic solution. I'm Dr. Anthony Davis, and I teach people with chronic low back pain and sciatica to reclaim the active life they love using evidence-based holistic therapies like exercise, nutrition, sleep, stress management, and understanding how to take their health into their own hands. If you want to know how to do the same, be sure to watch the masterclass in the description. Now, if you've had chronic pain for a long time, you've probably been told that your pain is due to something physical, like a disc herniation or asymmetry or bad posture. But just like this red dye, those physical factors are just a drop in the cup. Or you could say a piece of the pie. Or maybe you've been told it's all in your head. It's all about stress. Or it's just because you have depression that you have chronic pain. Or that it's nervous system dysregulation. You're stuck in fight or flight. They call that dysautonomia. But back to the cup, when you take the physical stuff and you put it in the cup, and you take the mental and emotional stressors and you put it in the cup, and you take crappy nutrition and you put it in the cup. And then we take a crappy nervous system that's dysregulated and you're stuck in fight or flight and we drop that in the cup. It doesn't matter the colors that are in the cup because guess what? It's all getting mixed up. And at the end of the day, who cares what color it is? When it overflows, it's too much and it causes pain. So we have a cup situation. Stop focusing on the colors and focus on the cup. In other words, you need a personalized approach that actually addresses all of the factors, the size of the cup, and how much stuff is in it. And this is why in the Beyond Back Pain program that I offer my clients a holistic vision, and it looks different for every single person. A lot of times people ask me on YouTube or in the comments section, or they DM me and say, exactly what should I do? Which exercise is going to magically fix my low back pain? Which supplement should I take? How do I manage stress so that I can fix low back pain? Well, I don't even know that stress is a factor for you, right? It may not be. You need to understand what of all the colors, what actually is in your cup, how much of it is in your cup, how full is your cup, how often do you get to drain the cup, how big is the cup, and how much stuff can you handle. Then you can put together a customized program for you holistically that addresses the biggest factors in the right order, in the right amount, based on your cup, your life, and your goals. And this is why everybody's rehab is going to look a little different. Some might focus a little bit more on the physical stuff. Some might focus more on stress relief. It really just depends on your cup, what's in it, how big it is, how often you get to drain it, how strong you are, and what your goals are. So I'll say it again. There is no singular root cause of low back pain and sciatica that is universally true for every single person. So stop obsessing with finding that one thing that's going to somehow solve all of your problems. What you need is a holistic approach that looks at your life top down. And unfortunately, because there is no such thing as a singular root cause, this leaves room for all kinds of scam treatments to pop up. Things that are very narrowly focused on fixing one tiny, very specific issue, and they'll convince you that that is the root cause, that if you just fix this one tiny little thing, then everything's going to magically fix itself. But that's not true. And so you can fall into the trap of doing all kinds of crazy treatment and spending lots of time, effort, and money on treatments that don't work, again, because they're just focusing on one tiny, narrow little part of the pie, one slice of the pie instead of the whole pie. So if you want to know how to avoid these scam treatments, these treatments that just do not work, that are not going to address the entire complexity of chronic pain as it appears uniquely for you in your body right now, then you need to watch the next video in this series. I'll teach you how to avoid some very common scam treatments for low back pain and what to do instead that actually works. So go ahead and watch that video now.